This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. We want to focus in our first segment on awareness. Awareness related to something that could impact your preteens, your teenagers, and even your college-age students. And it has to deal with sexual trafficking. We're going to revisit a discussion we had with June about a year ago as she points out some key areas that parents should be aware of to help protect their children. And for her protection, we altered the tone of June's voice. June, welcome to the show. Please tell us your story.
Yeah, of course. Thanks for having me on today. My trafficking actually started when I was very young. My mother was the one that actually sold me for the first time when I was 11. She came from a long line of addiction, just some mental health stuff, and it's one of the stories that I embrace today, but it was definitely not easy to live then.
So, June, what I hear you telling me is not only did your mother sell you, she was like the John in human trafficking. Is that correct?
Yes, absolutely. She controlled everything from how much I could sleep at night to who I had to service and all the things that kind of go along with that.
How vast is it?
It is every day. It is in your community, and if you think it's not, you need to just open your eyes. I was a victim of human trafficking, now I'm a survivor, but for me, the way it was portrayed on TV, where people were locked in basements and chained up, yes, that does happen, but more frequently it's through force, fraud, and coercion. But it is just so vast, even in the places you don't really think about, like sporting events or high school campuses, college campuses. It is literally everywhere. I think the most important thing is for people to open their eyes and see, and not to have so much pride as to, well, I would know it was here if it was here. No, it's there. And you need to realize that it's there, because if you close your eyes to it, of course, you're not going to see it. But if you open your eyes, you will see it all around you.
On a scale of 1 to 10?
It is definitely a 9 or a 10.
Wow. A 9 or a 10. Is that in high school, college, or all of the above?
Oh, let's go down to elementary school.
Yeah, junior high, elementary. There is always that market.
So in other words, basically, any parent listening to this whose kid is in elementary, junior, high school, college, the kids probably know all about this.
Well, they may not know all about it, but the chances of them coming into contact with someone who is trying to groom them, or online, or have a friend that is right in the middle of it, there is a 9 or a 10, that chance that they have been exposed to it in some form.
With the extreme, incredible rise in pornography, is there a correlation, a connection between this and pornography?
Oh, absolutely. And because so much stuff is done online, there are websites that you can, buy people and set up dates and things like that. And it's one of those things where sex and porn and all these things are always at the forefront right here. Even, right here in America, it's probably one of the largest. But there is always going to be a business for human trafficking if there's a business for sex.
June, I've seen statistics that show that 40% of children and adolescents that are in human trafficking come sometime through the state of Texas. And that's because of Interstate 10, Interstate 35, and that if you have runaways that just, you in your case, unfortunately, your mother did this to you, but runaways when they're gone over 24 to 48 hours, there's a good chance a John has tried to approach them. So Texas, unfortunately, from everything I read, has a terrible human trafficking problem. Would you agree with that?
I absolutely would. I ran away after several years with my mom, and I landed right into another situation with a guy. And, it was a bad situation. It was kind of worse than my mom. But the thing is that Texas does have those interstates. It does allow you to go wherever you need to go very quickly and kind of under the radar. But, another thing in Texas is there is a lot of space. There is rural communities where, you really see the corruption in the police departments, and the emergency services there are not set up to handle trafficking victims. So, you can be in a rural community and be traveling to the larger cities and then go right back to your rural community and no one knows a thing.
June, when I talk to some of the folks in our emergency departments at hospitals, you're so right, and I hadn't really thought about it until you framed it the way you did. When they have an uncle come in with a young girl and maybe they suspect sexual harassment or trafficking, they can kind of put two and two together. They can look for sometimes a tattoo behind the left ear. But when your own mother brings you in and your mother fabricates the story to be told, it's very difficult. So first, we want to thank you for taking the time to share with our listeners just how serious human trafficking is. But I want to ask you, as you have come out of that life of human trafficking, what's been some of the biggest obstacles?
One of the biggest obstacles for me is trust. I have a lot of issues with some PTSD stuff and just general trauma that people who have come from where I come from have. But one of the biggest ways that shows up is I don't trust people. I know that somebody wants the best for me. I can never just fully trust them and open up, because there's always this sense of they're going to hurt me, especially in my relationships, friends or other women in my life, just because a lot of that did first come from my mom. But I just struggle in relationships a lot, and not romantic relationships, but just the everyday relationships, with my best friend or with coworkers or just the people in my life, because I never know when somebody's going to want something from me or when they're going to turn on me.
This is an incredible story from an amazing young lady named June, who is now working with a local nonprofit to help other people who have gone down this same path. There are many programs in our local hospitals to help victims of sexual abuse and rape, and we are going to talk to Cindy Burnett, who runs one of those programs at Texas Health Resources. Hear what our local hospitals are doing to address this problem next on the human side of healthcare.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. In our previous segment, we gave an extreme example of June, who was sold into human trafficking. But many times victims have to deal with date rape, uninvited sexual advances. Many of the people that perpetrate these advances are known to the victim. It could happen anywhere, at home, at school, at college. We're going to be talking with Cindy Burnett, who is the Sexual Assault Nurse Examiner Program Director at Texas Health Resources. Now, many of our hospitals have the same program, but she's going to go in depth and explain not only what happens to the victim, but many times they are afraid to even talk about it or speak about it. And this program deals not only with the the physical harm to the individual, but it gathers forensic evidence that can be used to prosecute the person that committed this crime. Cindy, welcome back to the human side of healthcare.
Thank you. Thank you for having me.
You know, for our listeners that may not understand the sexual assault nurse examiner, which I'll now refer to as SANE or the SANE program, can you tell us about this program and how long it's been in existence?
Of course. A sexual assault nurse examiner program, they employ registered nurses that have received additional specialized training to treat victims of sexual assault. This training goes beyond what nurses get to become a registered nurse. It's additional training. They're specially trained to provide crisis intervention and emotional support, a comprehensive and detailed health assessment of the victim's body for any kind of injury. We recommend what kind of appropriate medical treatment might be needed for the victim, as well as collect forensics evidence off the victim's body, because really that is our crime scene. Beyond the medical care as well, the sexual assault nurse examiner also plays a part in going to court and providing expert testimony during the judicial process that goes on after the assault.
You know, many of our listeners probably hear you and think of sexual assault, but could you give some statistics to kind of underscore how serious this issue is?
Sure. It is estimated that 1 in 6 women and 1 in 10 men will actually be a victim of sexual assault somewhere in their lifetime. For the great state of Texas, you know, that equates to about 33% of all Texans. You know, and as alarming as these statistics are, they're really still inaccurate because it only takes into account sexual assault victims that either come forward and disclose to a law enforcement agency or to medical professionals. There are so many victims that do neither of these, and so those numbers we're just not able to catch in our statistics.
You know, those statistics are quite alarming, and I think not only are you involved in helping treat through this SANE program, you're trying to educate as well. Can you give us a little background, please, about this collaborative project you're doing with Tarrant County College?
Yeah, well, although we know really that sexual violence can happen to anyone, statistics show that our population of young adults, like 18 to 24, they tend to be more at risk. We tend to see more sexual assaults in that age group. And that also just falls into the age group of many first-time students, college students. And it's actually estimated that 13% of all college students in the United States are a victim of some kind of sexual violence, you know, during their time on campus. You know, because of these statistics, the federal government also has the Campus Sexual Violence Elimination Act. This is a federal law that all higher education institutions, they're required to provide some ongoing sexual assault prevention and awareness education to all of their students and their faculty. Because of this, Tarrant County College, they reached out to us here at Texas Health for just some assistance to provide this type of education. And we gladly jumped on board. I mean, Texas Health, we take great pride in assisting our community partners. So this was just kind of a no-brainer for us, especially since our goal is to make our communities healthier and safer, you know, for everybody. And when we're able to educate the community about sexual violence, we're just one step closer to achieving that goal.
You know, in looking at some of the program information, there's something called the red zone. And you think in terms of, as you said, college students, even high school students. What is the red zone? And tell our listeners how it relates to students.
Yeah, that red zone for college students, and that's like the very first of college. It's like from the beginning through the first holidays, you know. That's the time in the fall semester where a lot of these college kids, maybe they're away from home for the first time. They're just out there and not quite ready to navigate the world. I mean, we all know that our brains don't really develop to age 25. And as we know, you know, college campuses, during this time, there's a lot of celebrations, a lot of parties. There's the Greek life, for fraternities and sororities. And sometimes that also brings up the topic of alcohol. When we start adding alcohol to things, everybody's inhibitions are down, or we might not really understand what we're doing. And that just makes that time period we call the red zone, because that's when we tend to see more of the sexual assaults coming from the college campuses.
This project and collaboration that you're doing with Tarrant County, you always have goals and expectations. In your mind, Cindy, what would be 3 goals that you hope to attain from this collaboration?
Yeah, because sexual violence is, it causes a lifelong consequences for victims and communities. And really it even costs the state of Texas like $8 billion annually due to sexual assault. We know that this crime is not ever going to be totally eradicated, but knowledge about the subject just goes a long way. So I think the goal for our partnership with Tarrant County College is to increase the community's knowledge about the different types of sexual violence. What I see as sexual violence and how somebody that was brought up in a different culture from me might be very different. So I think that the education as to what sexual violence actually is, creating a culture that encourages and supports sexual assault reporting, whether that's on campus or off of campus. I talked that there's just so many assaults that go unreported and that we can account for. And the 3, of course, would be decreasing the number of sexual assaults on college campuses, and really in Texas or North Texas and all. That's our goal. That's how we're going to make our community safer and healthier, as if this crime just doesn't happen.
The statistics you gave are really eye-opening. And for our listeners out there, if they have survived a sexual assault, do you have any nuggets of information you could share with them?
Sure. First and foremost, for me, I think a victim needs to know that this assault was not their fault. It doesn't matter the circumstances around the assault. It was no fault of their own. This was an action that, somebody else chose to take. After that, it's like we want them to get to a safe place if they're not already in a safe place, and to call somebody that they trust, that can help them navigate what's going on. Often they're just not thinking straight, and, they're under a lot of stress. We want them to come to the hospital, even if they don't think that they're hurt. Go to their nearest hospital, preferably one that has a sexual assault nurse examiner program, and even call 911 if they have some injuries. There are lots of things that we would love for a victim to do, to preserve evidence, such as maybe not bathe, not change their clothes, that type of thing. But if they have, it's completely okay. We still want them to show up at the hospital, even up to 5 days down the road. We can still see them, provide medical treatment for them, even collect DNA evidence off their body. We offer medications to prevent sexually transmitted infections and even to prevent pregnancy. There's just really nothing that a victim can do wrong. We want them to show up. We can collect evidence up to 120 hours. Another part of the big thing that the sexual assault nurse will do, will tell them their rights as a victim. People don't understand that they do have rights, especially if they're adults over the age of 18. They have the right to have an exam and not involve law enforcement if they don't feel it's safe for them, or if they don't feel like that's what's the best for them at that time.
We are talking with Cindy Burnett. She is the SANE Program Director at Texas Health Resources. SANE is the acronym for the Sexual Assault Nurse Examiner Program. Many of the hospitals across North Texas have specially trained nurses in this program, as Cindy has been describing. If you missed the first segment of our show, where the young lady June, who we used a fictitious name, was sold into human trafficking in North Texas at the age of 11, it's worth listening to be aware of the scope of this problem. It's on our podcast, The Human Side of Healthcare. Back right after this quick break.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back to the show. We're continuing our discussion on the awareness of widely available services here in the Metroplex related to something that'll protect your kids and your entire family. And we're talking about sexual assault. We're talking with Cindy Burnette, who's the Program Director for the Sexual Assault Nurse Examiners Program at Texas Health Resources.
And just a reminder, if this is something that you need to explore, these SANE nurse programs are available across many of the hospitals in North Texas. So there's one near you.
What type of training does a SANE nurse have?
Well, they have to be a registered nurse to start with, and they have to have at least 2 years of experience. And then we have a didactic course, kind of like a college course. It's a 40-hour course that's approved by the Attorney General's office. After we have that course, then we start into what we would call our clinicals, as nurses call them. And then they have to go along with another sexual assault nurse examiner and do at least 8 exams with somebody. After all that's done, then we can turn in their paperwork, and it's kind of strange. We're certified by the Office of the Attorney General, not by the Board of Nursing. We have to keep our Board of Nursing, but we also, because we're working with the law, we're certified under the Attorney General's office. That training sometimes doesn't sound like a lot when I'm saying what needs to be done, but it really takes at least a year, and it can take up to 2 years to actually get somebody certified.
The other important thing I think that our listeners really need to glean from this discussion is if you go to a SANE program, if you've been raped, following what is required under legal protocols are all followed, especially if there's going to be prosecution. Would you agree?
Oh, yes. We do everything by the book, the way we collect evidence, who's in the room, documenting that type of stuff. Whenever the actual sexual assault kit is closed up that contains the DNA evidence, it's initialed by us and sealed. It's then handed off to law enforcement, and then they take it and follow their chain of custody as far as getting it to be tested or getting it to their property room. But the same thing also happens if we don't have law enforcement involved. There is also a non-report option for individuals that are over the 18 and over. And this law came about so that we could encourage more victims to come forward that may have a reason why they don't want to report that to law enforcement. But we still treat that evidence the same. We still can take evidence off their body. We maintain chain of custody, and then it goes to a DPS warehouse for storage. So in case this victim ever changes their mind, we still have that DNA evidence. If they change their mind and want to go to law enforcement, then we can still retrieve that kit, and law enforcement has that DNA. And the chain of custody is just as good on that kit as it is on one that I hand directly to a law enforcement officer.
Thomas and I have interviewed different people in the medical profession, and because of the pandemic, a lot of people have been afraid to come to hospitals. Over the last 2 years, has that had an impact on people coming to the SANE units?
Oh, it definitely has. When the pandemic first hit, we really saw a decrease in victims coming forward. The research is still out on it, but from all of us, the consensus is the sexual assaults didn't stop. We feel that people were fearful to come to the hospital because either they were afraid they were going to contract COVID while they were there or be exposed, in some way or form. Another issue was that a lot of sexual assaults happen within the household. It's either an intimate partner, a parent, that kind of thing. They couldn't get out. They were quarantined with their abuser. So even though we saw a decrease in victims, it was still happening. And then the bad part is it seemed like the violence that was going along with these assaults also grew. We were seeing more people that had physical injuries that needed medical care as well.
Cindy, what about in college? You and Steve were talking about college-age kids, and as you pointed out, alcohol, of course, a part of many events on the campus and off. But what about drugs, the date rape drugs? Are we seeing those as well?
We do see a lot of the different drugs. Of course, it's very hard whenever they come into us for us to really pinpoint it down. Most of the time, they just are saying that they have a memory loss, that they were somewhere and they were doing something and all of a sudden they don't remember the next, few hours. And so we do see a lot, and it's different drugs. I mean, we actually do not get the results of those tests. That is part of evidence as well and is sent to a crime lab, because the crime lab can actually test for multiple drugs, whereas the hospital, it just gives kind of classifications of drugs. But we've seen all kinds of things, anywhere from Xanax to, the date rape drugs like Rohypnol and things like that. Recently, we had a case that come back with Propofol. Propofol, if you don't know, is the drug that we use to keep people asleep. In fact, it was the drug that Michael Jackson was overdosed on and died. So it can, not only is it being used to sexually assault somebody, but it's also, these things are very dangerous in general.
So if somebody has been violated, I would think in a young woman's position, she would want to go to the safety of her home and family, but often that's not a safe place. So I'm just thinking, where do you go where it's safe?
Well, and it may not even be a safe place, especially when we're thinking about college students. You don't want to go back and tell mom and dad what happened because you don't want to be pulled out of college. So if it's on a college campus, that's what the Title IX offices, and they should all have campus police, sexual assault. They're made to protect these students. These students can go and have their classes changed. They can have their maybe dorm room changed so they're not in proximity of the person that is being accused of assaulting them. And again, they're innocent until proven guilty. But if it's not on a college campus and maybe it is at home, whether it's a partner, a parent, or some other family member, we also have all kinds of resources to shelters that we can definitely get somebody from the hospital into a safe place immediately.
Wow, that's a treasure trove of information right there that I'll bet most people don't know.
No, most people don't know their rights, and that's the great thing if they will just come forward to get medical care, because we're trained to give them their rights and all the resources that they need. Our goal is the minute they walk in, we start safety planning. And if they're not safe to go home where they're at, we definitely want to make sure that we involve them in the decision, but get them to a place that is best for them.
You are an expert in a field and an area that most people literally almost don't know anything about. So if you could speak directly to parents based on your years of knowledge and training and skill, what would you tell them about making it safe at home for their kids?
I think the biggest thing is open communication. Nowadays, with all the social media and that these kids are on, knowing that mom and dad are safe to come to, maybe somebody says something inappropriate to them, on a text or on a snap or, all that lingo that's out there, but that they have that relationship with mom and dad, that they can come and tell them, hey, this happened. This is what happened to me, or this is what I saw. The other thing is, I think we just have to be real. Drugs and alcohol are out there. They're out there to the young kids, ages 11 and 12, we're even seeing it. And again, knowledge is power. If we are open with these kids, and I say kids, and they may be 18, 19, 20. To me, if it's your child, that's your kid. The more we're open with them and the more we can educate them and not hide sex, because it is a normal part of life, the more that these kids will be willing to be open and come to them when they have a problem or when they have a question that needs to be answered.
How have you seen this progress over the last, say, 10 years?
It has gotten better, as far as being able to educate individuals. There's still just a lot of taboo about talking about sex in school, whether it's a healthy relationship or not. And to me, that is a huge thing, is teaching individuals, and not just kids, adults, what a healthy relationship is, what consent is. Although it is a lot more out there and it is a lot more open, there's still just those households and school systems and churches that they're very against talking about these things because they believe in abstinence. And I do too, but the problem is that this is out there with other people. We have to have our kids and our community ready to hit this problem head on.
Cindy, this has been great, so informative and so important. Any final thoughts?
I just want people to know, that we're out there to help you, that these SANE programs, whether it's a Texas Health program or whether it's a program from another hospital, we're definitely out there to help victims. We want to make them feel comfortable. We want to alleviate some of their fears and of not knowing what to do. We can get them in touch with resources if they need them for counseling, that type of thing. We just want these victims to come forward for some medical care just to make sure that, A, their bodies are okay, but B, we also get them lined up to prevent consequences down the line, whether it's social, emotional consequences, or it's even physical consequences such as, disease to their body. To me, that's the most important thing.
This has been Cindy Burnett. She is with Texas Health Resources, runs the Sexual Assault Nurse Examiners program there. Cindy's going to be on with us in upcoming weeks on other topics as well. We'll look forward to that. Now, when it comes to cancer, there is one key ingredient, and that is early detection. Well, we are going down to Baylor University Medical Center. Megan Fitzpatrick is a diagnostic radiologist there. She is going to tell us about a new high-risk breast screening program. Ladies, this is something that you're going to want to hear about. Next on the Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is the Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the Human Side of Healthcare. Delighted you're with us today. And we're going to talk today about high-risk breast screening and a program at Baylor University Medical Center. We're delighted that we've got Dr. Megan Fitzpatrick with us today. She's a diagnostic radiologist. Dr. Fitzpatrick, welcome to the show.
Oh, thank you so much for having me.
We all know that there's a lot of data that we can look at, and we know in healthcare that data saves lives. And we continue to look at it, utilize it, refine it so we can help people. Can you explain to our listeners how data can help women with high risk for breast cancer?
Absolutely. So, Steve, as women, we are all at risk for developing breast cancer, even without known risk factors such as a family history. However, there are a significant number of patients who fall into a category that we call high risk, which means a higher than 20% chance of developing the disease. And through this program, we are using patient-centric data to identify and help serve these patients. Study after study is showing that early detection means a better chance of having a good outcome. So our goal as breast imagers is always to detect breast cancer in all of our patients as early as possible, primarily through annual screening mammography. But if we can identify high-risk patients, then we can empower them with information and help create custom plans that are tailored to their needs, which may involve supplemental screening studies, for example, and that aids us in early detection for these patients.
As you look at this new high-risk breast screening program at Baylor Scott and White Health, how are you identifying these patients and what their real risk is?
Well, it starts with asking the right questions, and it's easy and free to participate. So we provide a short survey to all of our patients who come in for their annual mammograms to help determine an initial Tyrer-Cuzick score, which I'll refer to as a TC score. This gives us an initial idea of the patient's risk for developing breast cancer. If a woman appears to be at elevated risk based on that initial TC score, Her chart gets flagged, and a dedicated nurse navigator from our high-risk program then reaches out to her and schedules a full detailed consultation to go over a more in-depth questionnaire with the patient on the phone. If the patient is confirmed to be at elevated risk during that phone consultation, then the nurse navigator would begin working with her and providing guidance on next best steps. For example, the navigator might let the patient know she would benefit from supplemental screening exams, such as breast MRI or ultrasound, which I want to take a quick second to emphasize that every woman age 40 or older should have a screening mammogram every year, regardless of their risk level. But there are some women who need to start sooner and may benefit from additional studies as well. So the nurse navigator goes through that, and she'll also discuss whether the patient would qualify for genetic testing to identify mutations like the BRCA gene, for example. She may also suggest preventative measures and help connect the patient with a breast specialist if that's needed. And then moving forward, the navigator checks in every 6 months with the patient, continues to help support them and connect them with the resources and information that they need. It's really about developing a personalized plan for the patient, one that is tailored specifically for them and their needs and concerns.
You know, that's excellent advice. I do want you to repeat one thing for our listeners.
Sure.
Dr. Fitzpatrick, how often should women get mammograms?
Oh, thank you for giving me the opportunity to repeat that and emphasize it, because it is the most important thing that I would like to share. And that is that every woman age 40 or older, regardless of her risk, should have a screening mammogram every year. Like I said, some women, depending on their risk, may need to start sooner and may benefit from additional studies as well. But if you are 40 years old or older, absolutely a screening mammogram every year is the best thing for you to do.
You know, in looking at these services related to the high-risk breast screening program, it's my understanding they're at no cost to the patient. Am I understanding that correctly?
You are understanding that correctly. And I'm very proud to say that our high-risk breast screening program and the services of the nurse navigator in particular are completely free of charge to the patient. This program was created thanks to very generous philanthropic support through our annual Celebrating Women effort. The effort raises funds each year for the fight against breast cancer. And thanks to this support, we were able to launch the program in 2020. And in the last year alone, have already identified more than 2,300 women who are at high risk but unaware. Many people, I just want to share this, many people may not realize that Baylor Scott & White is a not-for-profit health system, and that initiatives like this, our high-risk breast program, are available to our patients through generous support from people in our community. And it's very meaningful to see the impact that this generosity has in the lives of real women who come to our imaging centers. Not only are we able to identify cancers earlier through this program, giving patients the best chance for a positive outcome, but we're also able to arm them with information on their personal risk so they can make informed decisions and really take charge of their health.
You know, we hear a lot about transparency in healthcare today, not only with pricing, but also with understanding clinical issues. And so as medical providers, we certainly want to be transparent. And we know that any cancer can certainly be a journey that has many turns to it, many decisions to be made. So how, in your mind, is this program helping get patients to treatment as soon as possible?
Well, this is all about clarity. Not only do women receive clarity through the information they get as to what their risk is, but they also have clarity in next steps thanks to their personal connection with the nurse navigator. I find that women have lots of questions about screening. What's the best screening exam for me? When should it be performed? And a breast cancer diagnosis can be very scary and complex and overwhelming and create even more questions for patients and their families, such as what doctors do I need to see and in what order? Together, our navigators in this program will not only help our patients understand their risk, but also help guide them through the impenetrable maze of screening and cancer care.
You know, for a physician in the service that you give, how does a program like this make you feel, especially for your patients?
Providers like myself and my colleagues, we have dedicated our professional careers to detecting breast cancer as early as possible. We truly consider it a privilege to walk alongside the patients that we serve. And this program allows us to reach the high-risk population and assist us in early detection for these patients. 1 in 8 women is diagnosed with breast cancer in her lifetime. I am very passionate about detecting breast cancer as early as possible to help that person and to give her the information and support that she needs.
Do you have any advice to the women out there, and I'm going to say women under age 40, but they have a history of breast cancer in their family? What's your advice to them?
Probably the main thing I would want to share to women that are under age 40, so they're below that kind of typical age that we start screening, but they know that they have a family history of breast cancer. I want them to take a look at that history. If they have a first-degree relative that has been diagnosed with breast cancer, so a mother or a sister, I want them to think about the age at which their family member was diagnosed, because they should start their own screening with mammography 10 years before the age of diagnosis in their first-degree relative. So for example, because I know that sounds a bit confusing, but if a patient has a history of breast cancer in her mother, and her mother was diagnosed at age 45, then she should actually come in and see us for her first screening mammogram 10 years prior to that. So when she is 35, she should actually start screening. So that's what I want to share with women that know they have a family history. They may feel like they're a little too young to start screening mammography. That's not necessarily true. Take a look at the age at which your family member was diagnosed, and you should be starting your own screening 10 years prior to that.
There's probably not a woman out there dealing with breast cancer who would say they got tested too soon or too often. Dr. Megan Fitzpatrick, diagnostic radiologist at Baylor University Medical Center, thank you for that great information. Steve?
Some great segments today, terrific information. Thank you so much for joining us, and we hope that you'll join us next week for more of the human side of healthcare.